Now, India has joined a growing number of countries who are demanding a comprehensive investigation into the origins of the COVID outbreak in China as it backed the World Health Organization chief's proposal to deploy additional missions. Without naming China, India noted that WHO Director General Tedros had raised the issue of delays and difficulties in accessing raw data for the UN Health Agency's report on the origins of coronavirus. It also sought more timely and comprehensively data sharing for future investigations. Well, for more on this entire controversy over the WHO COVID report, as well as the issue of vaccine equity, we're now joined by Professor Lawrence Gostin, Director, O'Neill Institute, and Director at WHO Center on Global Health. Thank you so much. It's great to have you on the show once again. The first question is, of course, about this controversy over the WHO report. The US and other countries have spoken out against the WHO report on the origins of COVID, and they've hit out at China as well. What is your view?
You know, the report was very disappointing. I mean, the independent experts were world-class scientists, so I'm not blaming them. But I think that China has blocked a full and fair and rigorous inquiry into the origins of SARS-CoV-2. You know, we have to remember that this is an investigation that's taking place over a year after the initial outbreak, and it took a year to negotiate with China to allow access to its soil into Wuhan. And even then, the Chinese did influence the report, and they didn't provide full and transparent information and samples to the team. And so this is a great tragedy for humanity because, you know, we've suffered so much. You have in India, we have in the United States, and we deserve to know what caused this pandemic. And the origins are extraordinarily important. So it is a sad day for humanity that we may never know what started the great COVID-19 pandemic of 2020.
Now, the WHO has said that this is an initial report, and also that they haven't ruled out the lab leak theory completely, though they do say it's unlikely.
I certainly think that the report is probably right, that this was a naturally occurring event in nature where a bat transmitted a coronavirus to an intermediary animal and then to a human. But we don't have proof of that. And the lab theory, I do think is unlikely. I agree. But I don't think that there's been a thorough investigation. Literally, China just gave the WHO experts a tour for several hours of the lab. It wasn't a full and independent audit. And the Dr. Tedros and the team itself has a call for further investigation, but I can't see that ever happening. If China delayed for a full year and didn't allow an initial thorough investigation, what would make us think that all of a sudden they would become transparent and accountable? No, I don't. I think this could be the end of the road. And even today, China has said that it wants to now focus on other countries around the world. And it singled out Fort Detrick, a lab by the US Defense Department. But there's no evidence whatsoever that Fort Detrick is involved. And basically, it's becoming ludicrous that China and the United States are pointing fingers at each other without any evidence whatsoever, and then the World Health Organization is caught in the middle. That's just no way to deal with a COVID-19 pandemic.
All right, well, let's shift focus now and talk about vaccine equity, which is a pet subject for you, and you've been advocating for it. How is the world faring so far? There have been allegations against the US for hoarding vaccines.
No, it isn't. It's really, quite disgraceful, and I agree with Tedros, the head of the World Health Organization, that this is a catastrophic moral failure or what the South African minister said, a vaccine apartheid. The US, the UK, Europe, Canada, other high-income countries have pre-purchased vaccines enough for twice or even 3 times of their population. They're hoarding the vaccines. At the same time, the European Union has slapped export controls over the AstraZeneca vaccine. India has recently done the same thing. But I think in India's case, it's more justified because you're a middle-income country and you have a terrible epidemic on your hands. India is also, I think, the engine to vaccinate the entire world. And so I give India very high marks.
All right. It's great that you say that. And yes, we have exported a lot of vaccines to other countries, though in India now that we've stopped that. But there has been some amount of anger over the export of vaccines to other countries.
Well, India is a very difficult case because you have this dual role of the second most populous country in the world with a lot of poverty and a lot of disease. And so I think that the claim from the Indian people to get a fair share of the vaccines is a legitimate claim, absolutely a legitimate claim, particularly the poor. And I would certainly like to see India return to exporting vaccines as soon as it possibly can. In my view, there are 2 ways out of this pandemic. Well, actually, there's only one way out, which is to vaccinate the world equitably. But there are 2 ways to ensure that scarcity doesn't interfere with vaccinating the world. One is that the US and other high-income countries have to donate not just money, but vaccine doses to low and middle-income countries. But even if you donate a dose, it saves a life, which is important. But if you transfer the technology so that the Serum Institute of India and in Brazil and other countries can produce the vaccines at scale themselves, then you save a country, then you save a world. And so what we have to do is tear down intellectual property protection, transfer the technology to India and to other high manufacturing companies of great competence. And then we also need to provide financial and technical assistance to those countries to help them ramp up vaccine supply for the world. It's not either or. It's not do we vaccinate the Indian population or vaccinate the world. We have the capacity to do both.
Well, that's a great idea, Professor Gostin, but I still don't know if countries or companies will actually do that, actually transfer vaccine technology.
I think they have to. Vaccinations are a global public good, and we're in the middle of a pandemic. Ultimately, I think these companies are harming themselves because, the world will not soon forget the selfishness of high-income countries and the selfishness of the pharmaceutical industry. They can do the right thing here, and sharing the technology is absolutely the right thing. No one should be making a huge profit off of the hardship and death from this pandemic. I just refuse to accept that behavior. And I think global leaders should feel the same way.
All right, Professor Gostin, thank you so much for speaking to us here at NDTV, and hope countries and companies hear what you have said about the transfer of technology and how it will help save the world.